Welcome everyone to our second in a series of 3 osteoporosis webinars, and good afternoon. Today's webinar is titled Osteoporosis Fractures, Impact on Black and African American Older Adults and Family Caregivers. NCBA would like to thank Amgen for sponsoring this webinar. We would like to thank also our presenter again today, Ms. Keisha Lewis. Ms. Lewis is a practicing occupational therapist and a certified diabetes care and education specialist with more than 17 years of experience working in the field of human resources, mental health, and physical disability. She serves as a consultant with the Health and Wellness Program for the National Caucus and Center on Black Aging. In 2019, Keisha co-founded Weldom LLC, an aging in place consultancy. Keisha's ultimate focus is empowering individuals with the skills they need to be independent in their environment without fear. Welcome again, Keisha, and I turn this over to you.
All right, Ms. T. So hi, everyone, and welcome back for part 2 of our Bone Health Matters series and impact on Black and African American older adults. Like Ms. Tellisford told us earlier, I am an occupational therapist. I, along with my business partner, Jennifer Judah, we founded Weldom LLC in 2019. And we believe in the power of prevention to maintain a healthy, safe, and fulfilling life, regardless of your age or your ability. So this presentation ties in with our beliefs. And so we use a whole person approach, and we address all individual needs and challenges in the home and understanding disease, potential, and progression. So I'm going to jump into the webinar. And if you joined us about a few weeks ago, I think it was last month, our topic was Bone Health Matters. And so thank you for coming back to join us this week. And so we're going to do a review of bone health. We're going to review the signs and symptoms, the implications in the Black community. We're going to look at diet, exercise, treatment, and care. We're going to discuss some policy implications and some resources and get a little bit into caregiver tips here. So we're going to review some stuff. So last presentation, we talked about osteoporosis and osteopenia. So I got a little pop quiz that's going to come up in the next slide. And so you can use the chat and I can see your answers, but can you tell me, what is osteoporosis? Is osteoporosis low bone mass that weakens bones? Is it when bones become thin and lose their strength, or is it when bones break? So what would you say osteoporosis is? Which one of those is the best answer, A, B, or C? And if you put it in the chat, I can kind of see what people are saying. Okay, I got B that popped up. B. Can anyone else engage in the chat there on what you think that answer is? All right, B, A, okay. All right, well, I'm going to go on. Thank you, everybody, for engaging and participating in the chat. So the answer we're going to get to next here, pop that up. So what is osteoporosis? Osteoporosis is actually bones that become thin and lose their strength, and they eventually can lead to breaks in the bone. Okay, so we're going to review bone health and some definitions here. So with bone health, remember we talked about last time we met that bones are made of living tissue. And so up until about the age of 30, when you're healthy, a healthy person builds more bone than he or she loses, okay? But then after that, by age 35, bones begin to break down faster than they build up. So as we age, our bodies tend to reabsorb these materials instead of keeping them in our bones. So our bone density decreases throughout life by less than 1% per year. And so the definitions there, we talked about last time we met, osteopenia and osteoporosis. So osteopenia is actually low bone mass and it weakens the bone. Whereas osteoporosis, known as porous bone, is when bones become thin and they lose their strength. And this eventually leads to bones that can break. So there are certain lifestyle changes when an individual has osteopenia, the low bone mass. Certain lifestyle changes can help preserve bone density and prevent osteoporosis. And not everyone that has osteopenia will develop osteoporosis, but it can happen. So people with osteopenia should try to strengthen and protect their bones, and their healthcare providers should monitor their bone mineral density. We see that osteopenia is often more common in older people, so people over the age of 50, people with poor nutrition, and then we see women after menopause. And so these are the individuals that we see affected with osteopenia. Other things, we're going to move on, I guess, to the next slide. Okay. So the next slide, we talked about actually what is osteoporosis. We'll get more into that. So osteoporosis, what we see is there's no specific single cause of osteoporosis, but there are many risk factors associated, and we'll discuss those as we move forward. But osteoporosis remains one of those diseases that's often underdiagnosed and undertreated. Bones affected by osteoporosis have much larger holes, and you can see the picture there where you see the normal bone on the left, and then on the right there's a bone affected by osteoporosis in which you see these larger holes and spaces, and this is what makes the bones less dense and more likely to fracture, and this is what leads to bones that actually break. So again, why should we be concerned about osteoporosis, especially in the Black community? So a lot of times people think that osteoporosis is just a white woman's disease. But fractures, they can affect everyone, including African-American and Black older adults. So fractures, when they do occur, they result in serious injury, illness, disability, and reduction in the quality of life. And sometimes this can even result in death. So the number of fractures, we see that can increase with age. And the most common types of osteoporotic fractures are femoral neck fractures, which are hip fractures, vertebral fractures, which occur in the spine, and then hip and vertebral fractures are also associated with an increased risk of death. And we have that in another slide that we're going to talk about. The other reason why this is so important for minorities, African-American and Black older adults, is because the life expectancy among minorities has increased. And so in 2017, the Administration of Community Living and the Administration on Aging released a report that African Americans made up of 9% of the older population. And by 2060, that's going to increase to 13%. And we also know from some data that was put out in 2021 by the Bone Health and Osteoporosis Foundation, about 1.8 million Medicare beneficiaries suffered from osteoporosis. And so that's one of the reasons why we want to talk about osteoporosis, and we want to bring awareness to osteoporosis and prevention. So what you have here, this is a great infographic. In 2021, the National Caucus and Center on Black Aging Incorporated partnered with the Bone Health and Osteoporosis Foundation. And so the infographic that you see there, Osteoporosis in the Black Community, Practical Tips and Action, was created at that time. The reason we talk about disparities in osteoporosis screening is because the numbers that we see, it's really alarming. So I took a piece out of this infographic and I highlighted it and made it a little bit bigger so that we can talk about some of those things there. So you see Black men and women often go undiagnosed, and then the Black community is less likely to be screened. And you see 8 to 20% less likely depending on the age. And so what we see is Black women are even less likely to receive medication to treat osteoporosis and prevent fractures. So this really is a problem. One study, we also found that Black patients were at greater risk for delayed surgery following a hip fracture. In another study, we found that Black patients had a 30% higher odds of not receiving physical therapy following a hip fracture. And then women in the Black community also tend to have less awareness about osteoporosis. Because oftentimes in our community, we think we have a larger bone structure, and we have healthy bones, and we have a thick bone structure, so this can't happen to us. So it's very important that we bring awareness so we can delay osteoporosis from occurring, and we can prevent it and actually treat it. Oops, I think I hit the link for the slide. I didn't mean to do that. So I have some links there. And so if you're interested in that infographic, the Black community infographic there is the bonehealth and osteoporosis.org. You can actually go to visit that site to see that infographic. So now if we move on, we talk about the impact of fractures. So hip fractures lead to loss of function and independence among survivors. And fractures are most often associated with osteoporosis, or fractures, that are most often associated with osteoporosis are hip fractures, spine fractures, and wrist fractures. And what you see, hip fractures significantly increase the risk of death in the year following fractures and are highly predictive of additional fractures. And so what you see there over there is at 33% dependent. Non-Hispanic Black women have been shown to average a 49 to 225% higher debility. So that's long-term nursing home placement and becoming a Medicaid dependent than their non-Hispanic white counterparts. So when we in our community experience a fracture, we're more likely to experience a decrease in debility because of that fracture. You see there 40% of individuals are unable to walk independently once they've suffered a fracture. 60% require assistance a year later. And then mortality is one of those other things that stand out. Non-Hispanic Black men and women have a higher mortality rate following a hip fracture than their non-Hispanic white counterparts. And then we also see that 50% of people with one osteoporotic fracture will most likely have another. And so it's very important. If you've experienced one, you're going to experience another. And so we want to work at prevention of this, because what we know is that osteoporotic fractures are preventable and osteoporosis is treatable. The other thing when we talk about the impact of fractures, and we look at what's underdiagnosed and undertreated. So vertebral fractures in adults age 50 years or older is usually an indication of osteoporosis. And this can even be in the absence of a bone density diagnosis. So the presence of a single vertebral fracture has a 5-fold increase risk for additional vertebral fractures. And so what you see is, unfortunately, vertebral fractures can go unnoticed for years before it comes to the attention of your physician. And so you see that slide there, it says approximately 80% of people who've had at least one osteoporotic fracture are neither identified nor treated for osteoporosis. Next, we're going to move into the risk factors. So we talked about this last time we met, and we're going to talk about it again. So risk factors, we have fixed risk factors, and then we have modifiable risk factors. And so those fixed risk factors are things that we can't change, okay? And some of those things you see is your age, your female gender, family history, previous fractures, our ethnicity, women that have experienced menopause, long-term steroid use, if we have a condition that we must take steroids, rheumatoid arthritis, hypogonadism in men. Those are things that are fixed that we cannot do anything about. Those modifiable risk factors are things that we can change, and we can educate individuals about it, and we can make healthier lifestyle choices to reduce these risks. And those things include alcohol consumption, smoking, having a higher body mass index, poor nutrition, vitamin D deficiency, various eating disorders, estrogen deficiency, and insufficient exercise. So those are all things that we can actually learn to do something about. So again, the impact of these risk factors in the Black community. So with menopause, what we found is that Black women experience menopause earlier than their non-Hispanic white counterparts. BMI also has an impact on the development of osteoporosis. And I'll talk about that a little bit later when we talk about vitamin D deficiency, because often when someone is overweight and experiences obesity, it decreases their ability to absorb vitamin D. Poor nutrition is also a risk factor that we see, as well as vitamin D deficiency, and we're going to talk about that more. And then secondary risk factors are diabetes, stroke, sickle cell, and breast cancer. And these are all diseases that we see more predominant in our Black community. And then the other thing is in the Black community, in men, there's not a lot of research out there about osteoporosis in men, but men in the Black community that have a history of CVA, or also known as stroke, and also have a history of diabetes, we see that they're at an increased risk of developing fractures as well. With diabetes, I would just point out that in our community, Blacks are 60% more likely to be diagnosed with diabetes. And we're also 50% more likely to have a stroke as compared to our non-Hispanic white counterparts. It was recently some literature that was put out that showed that individuals with diabetes were more at risk for developing osteoporosis. And I actually read that, I think, probably last week sometime. So it was something that was pretty new that came out. So osteoporosis screening. So I have another question to just check in to see if you were listening last time and if you've had this conversation with your physician. So we talked about osteoporosis screenings and what that test was. And so if you remember, again, I'm going to ask you to enter your answers in the chat for me. But what is the name of the screening tool that we should ask our doctor about? So A, is it an MRI? B, is it an X-ray? C, an ultrasound? Or D, a DEXA scan? So if you enter your answers in the chat, let's see what you say here. Okay, I see D. Anyone else? Okay, something else just popped up. I see D. All right, so you guys definitely were listening. And so yes, osteoporosis screening, that bone density test, it's performed using what we call a DEXA scan. And that's a picture of that DEXA scan there. And so preventative bone density scans, that DEXA stands for dual energy X-ray absorptiometry. I knew I was going to say that wrong. Scan. So DEXA for short. That's why we say DEXA. And these screenings are easy. They're painless. And what they do is they measure how strong your bones are. So it is a screening and diagnostic tool. It usually takes no more than 25 minutes, and many people are in and out of the room in less than 30 minutes. So it's a quick, easy appointment, and it's painless. And what the scan does is it measures your bone mineral content and mass. And they're able to detect whether you have a depletion of bone calcium and protein, which could put you more at risk for a fracture. And they also are effective in showing more detailed images of the bones than a standard X-ray. So the DEXA scans can be better to predict broken bones. So what we know is that disparities actually exist in the testing of actually taking this test. So in the US, patient access to osteoporosis care we see has declined. There are fewer office-based facilities that perform the DEXA study. And then fewer women and men are diagnosed with osteoporosis and are treated to prevent fractures, which correlates with the increased risk of fractures. So the Bone Health and Osteoporosis Foundations, they actually have recommendations for the test. And in the next slide, we're going to talk about some of those recommendations. So who should be screened for osteoporosis? So the National Osteoporosis Foundation, they recommend any person who has sustained a hip or a clinical vertebral fracture, women over the age of 65, men over the age of 70, and individuals over the age of 50 with risk factors, including frequent falls, a low body mass index, low calcium intake, vitamin D insufficiency. And then the U.S. Preventative Services Task Force, they include additional recommendation, and that includes women who are postmenopausal under the age of 65 with risk should be screened. So now we're going to move into the action part, the things that we can do. So I have that on there as let's take action, because that's what we want to do. Because remember, osteoporosis, we can prevent it and we can treat it. So one of the important things to remember is for us to have adequate and proper nutrition. So inadequate nutrition is a major risk factor for osteoporosis. So Black Americans may be at an increased risk for osteoporosis due to lack of calcium and vitamin D. So we're going to look at each of those areas a little bit more. Remember, in the first slide or second few slides that I talked about, I emphasized that bone is a living tissue. And so nutrients serve as an important part to help us maintain good bone health. And inadequate nutrition can lead to significant loss of bone and place individuals at increased risk for fractures. So we're going to move in and we're going to talk about calcium. So milk and dairy products are an excellent source of calcium. But many Black American women may be at an increased risk for osteoporosis because they consume less calcium than the recommended dietary allowance. What we know is that up to 75% of Black Americans are actually lactose intolerant. And this can prevent many of us from consuming dairy products, which remember I just said were excellent sources of calcium. And so actually an excellent source of bone strengthening calcium and vitamin D, which we're going to talk about vitamin D. But in fact, Black women's calcium intake is 50% less than that recommended daily allowance. And calcium really is necessary for normal bone development. And it's best absorbed by consuming calcium-rich foods. And so we're going to talk about calcium-rich foods in the next slide. Well, not quite, almost calcium-rich foods. So actually, what is the recommended dietary allowance of calcium? So I have this chart here for you to take a look at. But what we want is your body has to be able to absorb the calcium in order for it to be effective. So choosing calcium supplements that contain vitamin D can actually aid in calcium's absorption. And calcium supplements are better absorbed when taken in small doses. So 500 milligrams or less, and often at meal times. But I would suggest talk to your doctor about the amount and the dose of calcium that you need. So what you see here on the recommended dietary allowance for adults, I have the list there for men and also for women. I'm going to go down to women, and then I'll jump back up to men. But in women ages 19 to 50, the daily recommended dietary allowance is at least 1,000 milligrams. Then you have an upper limit, which the upper limit is just we don't want to take more than that. And so 51 and older, at least 1,200 milligrams of calcium. And then in men, if we look at men that are ages 19 to 50, the recommended dietary allowance is about 1,000 milligrams. And in men 51 to 70, 1,000 milligrams. And in men 71 and older, actually 1,200 milligrams of calcium. And so in the next slide, we're going to talk about some other ways. Because remember, I just told you, hey, we as African Americans, 75% of us are lactose intolerant. So if I am not going to drink milk, how else can I get my calcium? You see in the picture there is actually a vitamin, so it's a supplement. So you can choose a calcium supplement that contains vitamin D that's going to help with the absorption, but you can also eat your calcium, okay? So in dietary sources, yes. So cheese, yogurt, and milk, yes, that's one. But also you can get calcium from fish, like sardines or canned salmon. You can get calcium from beans, lima beans, kidney beans. Your nuts have calcium, so almonds. Certain dark leafy greens, collard greens, spinach and kale. And then fortified foods like bread, cereal, and soy products. And what we recommend is that you consume at least 3 servings of dairy or other calcium-rich foods a day. So something that you could think about is, okay, well, maybe I'm not going to eat all this food, but how can I incorporate calcium into the meals that I eat? So if you eat oatmeal, you can mix oatmeal with milk. You can mix your oatmeal with some almond milk or any other calcium fortified beverage. You can eat a cup of low-fat or fat-free yogurt with fruit in it, or you can add some almonds to it. You can top a baked potato with steamed broccoli. You can add calcium-rich greens such as collard greens or kale to your meals a couple of times a week. And so those are ways that you can increase more calcium. Another picture I have here on this slide is these are some other options for calcium-rich foods that you may never have even thought about. So bok choy, pumpkin seeds, okra, turnip greens, prickly pear, leeks, Brazilian nuts, artichokes, avocado, celery, green beans, coconut meat, which is the thick part of the inside of the coconut, onions, gooseberries, spinach, kale, butternut squash, Brussels sprouts, cabbage, sapote, which is I think it's a more of a fruit that's found in Latin American countries. Gooseberries, I did mention them. I see them more in the islands. I've seen gooseberries, the Caribbean islands, I should say. Sesame seeds, asparagus, these are all foods that are rich in calcium. So I provided this list is because I want you to be able to see that you have options, and there's a lot of different foods that contain calcium. So if dairy is not our thing, we can still manage to incorporate calcium into our diet. Now we move and talk about vitamin D. So vitamin D, it's essential for proper function of our nerves, our muscles, and our immune system. And so we often think of vitamin D as the sunshine vitamin. So in older adults and Black Americans, we're at an increased risk of developing vitamin D insufficiency. I know I'm one. Every time I go to the doctor tells me I have vitamin D deficiency. So one of the things we know is as we age, the skin's ability to actually absorb vitamin D declines. And in addition, older adults are less likely to spend time outside than younger people. And so this actually might contribute to some of that vitamin D deficiency. And then skin pigmentation is also one of the several factors that can determine how much sun exposure we need. So as a Black American, I have a darker pigmentation, and this lessens my ability to be able to absorb the vitamin D in the skin. And so the other thing that we see is obesity, which I talked about earlier. So obesity rates are higher among Black and African American, particularly women in the United States. And so this can actually play a role in keeping vitamin D levels low because obesity actually reduces our body's ability to absorb vitamin D. So now you're saying, okay, Keisha, well, how can I increase my vitamin D? You just said that I'm not going outside as much. What can I do? Well, it is a sunshine vitamin, and I would encourage you to go outside and get some absorption for sun. And we're going to talk about that a little bit more. Because it's important that we still have to protect our skin when we do go outside. So I'm going to move on to that, and we can talk about that. All right. So how do you increase your vitamin D? So sunshine. And when I say sunshine, I don't mean to go outside and sunbathe. But with sunshine, 10 to 15 minutes outdoors with direct sun on your hands, your arms, your face, 2 or 3 times a week will give your body some of the vitamin D that it needs. If you are going to be outside for an extended period of time and you're going to have extended exposure to the sunlight, you do need to put on some sunscreen, okay? The other thing is you can take vitamin D supplements. So vitamin D intake should not exceed 100 micrograms. So a lot of times on the bottle, and I put the bottle of vitamin D there because this is usually how it's written on there. You'll see the micrograms, and then you'll see the IU, which is just the international unit. And then recommended daily amounts for adults 19 to 17 is 15 micrograms or 600 international units. And the recommended daily amount for adults 71 or older is 20 micrograms or 800 international units. So you really need to speak to your doctor regarding your need to take vitamin D and actually vitamin D supplements and actually how much you need to take. Because an excessive amount of vitamin D can also damage your kidneys. So we want to be careful with how much we're taking. This picture below highlights other sources of vitamin D. So not only the sunlight, but cod oil, caviar, mackerel, salmon, sardines, tuna, mushrooms, raw milk, and eggs. They're all sources of vitamin D, just as well as the supplements. So when we look at osteoporosis, when we age or as we age, one of the things is as the population ages, it's critical for clinicians to be able to intervene and help out. So we know that falls occur in approximately 1/3 of adults older than 65. And this increases their risk for fractures. So as we age, your fracture risk will increase. And as you age, your bone mass density declines. So being able to speak to your doctor, being able to see a health professional that can assist with your balance, to assist with fall prevention is key. Because as we age, there are factors that contribute to falls, and we want to reduce that. And so now we're going to talk about exercise for osteoporosis. We hinted on it last time, but we didn't really talk about the specifics. So with exercise for osteoporosis, the one thing that I want you to remember is that if you have osteoporosis, if you're at a high risk for falls or fractures, or if you have a medical condition affecting your ability to exercise, you first need to check with your medical provider, okay, before you begin any exercise program. There's a lot of community-based exercise programs depending on where you live throughout the country, through senior centers, community centers that you could participate in. Also, if you have problems with balance, if you're at risk for falling, talking to your doctor about interventions from a physical therapist or occupational therapist are key. So benefits of regular exercise. So regular exercise will increase your muscle strength. It will improve your balance. It will decrease your risk of bone fractures. It will also maintain or improve your posture, and it will relieve and decrease pain. So exercise has many, many benefits. And we want to aim for at least 30 minutes of exercise, 5 or more days out of the week to help us. Now, if you have osteoporosis, you are at risk for a fracture, you want to avoid high impact and fast moving exercises that might place you at risk for falling. If you're at risk for fractures, you want to avoid jerky or rapid movements in general. And then keeping your bones and your joints and your muscles healthy can help ensure that you're actually able to do all of your activities of daily living. So are you able to dress yourself, bathe yourself? Are you able to cook? Are you able to do light cleaning tasks? All of this is very important because this is going to help you maintain your physical activity. So then we move into weight-bearing exercises. So the types of exercises that you can do. So weight-bearing exercises include walking, jogging, and dancing. So things that even you can have fun with. And weight-bearing exercises are our focus with osteoporosis. So weight-bearing exercises means that your feet and your legs are supported with your body weight. And you want to speak to these exercises, and you want to talk to your doctor about engaging in these exercises because these are the exercises we focus on to help protect our bones. And even walking. So walking as little as 3 to 5 miles a week can help you build your bone health and bone strength. So these are very important activities for you to engage in. And so using your resources. So here, I'm not going to be able to copy the links here, but at the end of the presentation, all of these links that I have, I'll take a minute and copy them and drop them into the chat. But using your resources to figure out what are weight-bearing activities. What should I be doing? How often should I do them? How hard should I be working? And looking at tips. So you see there, I have discussed with your provider. The exercise is medicine is a handout. And then the bone health, the National Bone Health Organization, they actually have patient treatment and exercise and safe movement guides. And these are some exercises that you would be able to engage in. These are exercise tips for you. And so at the end, I will put these links in the chat. So then when we look at tips for just daily living, so now we've talked about exercise. We talked about our nutrition, so our calcium and our vitamin D intake. We talked about engaging in exercises. And now we're going to talk about just tips for daily living. So if someone has osteoporosis or is at risk for a fracture, one of the things you should think about is your daily activities and what you do. So an example I'm going to review here is lifting items. So when you lift an item, you need to know your own strength, and you only need to lift what you can handle. You want to always lift and carry the load close to your body. You want to make sure that you're bending at the knees and letting your legs do the work as you're lifting up. Don't twist your back or turn with your feet because you're more at risk, maybe of fracturing something. So lifting items, you got to be careful. And then when we look at safe sitting, so oftentimes we don't think about sitting. We just boom and sit down. But avoid low, soft chairs that have poor back support. Use an upright, firm chair that does not allow your lower back to slouch. Because if your lower back slouches, then you're more at risk perhaps of having some of those small vertebral fractures that can go undetected. When you get up from a standing position or seated position, you want to get up, you want to straighten your back out at least every 30 minutes. So don't sit in a chair too long. You want to get up and stretch. You want to get up and stand. So those are just some tips for everyday daily living. Other tips we have is standing. So when you're standing and you're engaging in activities, especially in the kitchen, I think about this one. You want to avoid bending forward. You want to have your working surface at a comfortable height. So your working surface isn't in a position where you have to reach and extend or you have to go down too low. You want to be in a comfortable height. Another tip for daily living and activity for those who have osteoporosis or at risk for maybe a fracture. This one I see a lot is getting in and out of the bed. So thinking about how you get in and out of the bed. So a good thing is use a firm mattress because that's going to give you more back support. If your mattress isn't firm, maybe it's time to think about, is it time for me to get a new mattress? When you go to get out of bed, you want to first get out of bed. You want to sit at the side of the bed. So you just don't want to jump up because sometimes you jump up, you might be dizzy, might increase your risk for falling. And so now we're going to talk about lowering yourself. So, okay, how do I get in and out of bed? So I'm going to sit at the side of the bed. I'm going to lower myself onto my elbow. And then I'm going to lower myself further onto my shoulder. I'm going to bend my knees at the same time. I'm going to draw up my knees until your legs are on the bed. And then you're going to roll your body and your knees together to face the ceiling. So you're going to have to visualize that. So remember, sit at the side of the bed. Lower yourself onto your elbow. Then lower yourself down on your shoulder. Bend your knees at the same time you're doing that. Draw up your knees until your legs are on the bed. Then roll your body and your knees together to face the ceiling. So now I'm looking up at the ceiling. And then you reverse that sequence when you get out of the bed. And that just makes or ensures that you're moving your body slowly. You're moving your body as a unit. You're not twisting. You're not putting things at risk for fracture. And so you're moving in a safe manner, okay, to get in and out of the bed. And that's something very small that nobody ever really thinks about, because oftentimes we just jump out of bed and get moving. And then with osteoporosis, there's some additional lifestyle changes. So I had this on there last time, but I didn't talk about it as much. And so I wanted to talk about it a little bit more this week. Is to avoid smoking and limit alcohol and caffeine. So the connection there is research has shown that there's a relationship between tobacco use and decreased bone density. So if we find that we're at risk for osteoporosis, or we have osteoporosis and we smoke, we want to look into smoking cessation programs to help us stop, because we don't want to decrease any more of that bone mass density. If you drink alcohol, if you drink excessive amounts of caffeine, you want to reduce that. Alcohol can increase the risk of falls, and it can lead to fractures. And also there's been some research that shows that alcohol consumption in high amounts can negatively impact bone health. And then the same with caffeine, is caffeine can actually interfere with your body's ability to absorb calcium. So I am not telling you that you can't have your cup of coffee. I'm not telling you that you cannot have, a caffeinated beverage if you want to. But what I am saying is you want to limit that. So an excessive amount of coffee would probably be like 8 cups of coffee. So you want to stay away from that. But 1 or 2 cups of coffee, you'll be fine. As far as your alcohol, again, just a single drink, if your doctor says that's okay, that's going to be fine. But when you get into the upper limits, an excessive amount of things, that does put you more at risk for decreasing your bone health. So treatment guidelines for osteoporosis, we did highlight this a little bit the last time, but I want you to remember pharmacological treatment is going to reduce the risk of fractures in males and postmenopausal females diagnosed with primary osteoporosis. So pharmacological treatment and intervention is really going to help. The next thing is your calcium intake, your vitamin D intake, making sure that you exercise and you protect those bones, making sure you implement some of those daily tips that I briefly talked about. And then evaluation of fall prevention, because remember, having a fall, puts you at more risk for having a fracture. So if you can reduce your fall, you can reduce your risk of fractures, okay? So with medication, again, those medication management's goal, the goal of medication management is to help with the reabsorption and bone formation. So medication management is going to treat osteoporosis. It's going to lower the risk for fractures. And then your provider may also prescribe calcium and vitamin D supplements to help complement medication. So it's important that your healthcare provider will work with you and help you keep track of your progress and perform periodic testing of your bone, your blood, and possible urine when you take medications. But sometimes some of the medications for osteoporosis, you have to take a little break from them, a little vacation from them. But that's something that you'll work with your doctor to manage. The most important thing is that you actually access to be able to get the medication to treat the osteoporosis, to lower your risk factor for falls. To lower your risk factors for fractures. That was a mouthful. But the other thing is, in order for the medication to work, you must take it as prescribed by your provider. Okay, you need to understand the medication and how it affects your body. Okay, so if you're not taking it, you need to take it, because that's the thing that's going to help you. That's what's going to treat this osteoporosis. So when you get that new medication, talk to your provider, talk to your pharmacist, ask them the tough questions. Why am I taking this? How should I take it? What are the side effects? How should I store this medication? Is there a difference between the generic and then the brand name? Make sure that you understand your medication and how it's going to affect you. And then the other things is important to understand insurance coverage. So again, insurance coverage, Medicare Part B, which is the medical insurance. It will cover the DEXA scan once every 24 months or more often if it's medically necessary. And remember, if you meet one or more of the conditions listed here, you're a woman whose doctor determines you're estrogen deficient, you have risk for osteoporosis, your x-rays show possible osteoporosis, osteopenia, or vertebral fractures, you're taking prednisone or steroid type drugs or planning to begin that treatment. You're diagnosed or been diagnosed with hyperparathyroidism. You're being monitored to see if your osteoporosis drug therapy is working. The Medicare will cover that DEXA scan. And this came straight off the Medicare's website under coverage, okay? And remember, and I said this the last time, but many private insurance providers, they'll cover the test as well under certain circumstances as a part of their preventative screening benefits. And so that's really important. Check with your doctor and check with your insurance provider. And then moving forward, just looking at policy actions, particularly when it is towards Black and African-American older adults, is that we need to close the treatment gap. A lot of the studies, we don't see a lot about Black and African-American women and men that have osteoporosis. So we want to bring access. We want to develop trust in our at-risk patients. We want to generate more data on minority patients. And there is some researchers, one in particular, she really researches osteoporosis in the African-American community. So generate more data on this. Generate more information on the effectiveness and safety of drugs with osteoporosis. Increase awareness and engage members of the minority community about bone health. So what we're doing here today, how we partnered with Amogen to be able to bring awareness to the community about bone health. Improving insurance cover for fracture prevention services, engaging our clinicians and increasing their awareness that, Black Americans, African Americans are at risk for osteoporosis and they should be screened. Connecting with diverse communities. So connecting, with organizations like the National Caucus and Center on Black Aging Incorporated, where we're tailoring and we're talking to our audience about education and communication. So we meet your individual needs and we can enhance the impact of the community. One of the things I will say is that something I found in my research that was in May of 2021, actually, one of the representatives introduced an increasing access to osteoporosis testing for Medicare beneficiaries. And it was in 2021. So there is some awareness, but remember, we need to close that treatment gap and we want to make sure that we increase access for everyone. And we know that biases do exist within systems, medical systems, and at the provider level regarding knowledge and cultural practices and communication. So we do want to engage clinicians and we do want to increase their awareness so we can bring screening and diagnosis and treatment to the forefront. And then lastly, because I don't run out of time and I want to leave some time for questions, is we want to make a plan for action. And so making plan for actions, following this 1, 2, 3, 4-step module is, osteoporosis prevention. It begins in childhood. We need to start the conversation with our younger family members to encourage exercise and proper screenings and proper nutrition. And just overall living a healthier lifestyle in which we avoid smoking, we limit our alcohol consumption. And so those are the things that we can do. We also see that recent research has shown us that African-American women, they do have risk factors for osteoporosis, and fewer are screened for the disease. And remember that the most commonly used bone measurement test used to screen for osteoporosis is the DEXA scan. So it's safe, it's easy, it's painless. So ask your doctor about it. Very similar to an x-ray, but not an x-ray. So ask your doctor about it, have a conversation with them, and then really focus on living a healthy lifestyle. And so to wrap up here, I have some resources. Again, in a minute, I'll stop sharing my screen and then I'll copy some of the resources and put them in the chat. But that bone health and osteoporosis.org, if you visit them, that infographic that I showed earlier, it talks about osteoporosis in the Black community and some of those disparities. There's also an article there that talks about the impact of osteoporosis and fractures in the African-American community. It was a bonetalk.org, which was actually with the Bone Health and Osteoporosis Foundation and NCBA. And that was a presentation that, we did in 2021. And then 10 things you need to know about racial differences in bone health is also an interesting article. So I would encourage you all to use some of these resources and check them out. And then these are some other resources. So the National Institute of Health, Osteoporosis and Related Bone Disease National Resource Center has some great resources. And as well as if you smoke and you want to stop smoking, you think about stop smoking, BeTobaccoFree.gov is a resource to help out with smoking cessation. And then part 3. So you guys get to hear me again on Thursday, April the 13th. And then what we'll do is we will actually move on and we'll review the importance of proper nutrition. So we talked about it today. You'll have a little pop quiz on some of that stuff. We're going to discuss the importance of physical activity, and we're going to identify types of physical activity again. And then we're going to discuss the role of proper body mechanics and posture. You'll get to see me and some photos demonstrating what's proper techniques for using your body. We'll learn about the role of balance in fall prevention. We'll make a plan of action to move forward if you or your loved one has been diagnosed or is at risk for osteoporosis. And then we'll speak specifically to some resources to help caregivers out. So part 3 of this series on bone health and why it matters will occur on Thursday, April 13th at 1 p.m. So I definitely look forward to seeing you all again then. And so here are some references that I used for my presentation today. And so I am going to now stop sharing, turn it back over to Angie and Angela, and then I'm going to drop some of those things in the chat, those links.
Keisha, wow, thank you. Part 2 was awesome, and I can't wait until April 13th. So many thanks for your awesome presentation, and many thanks to Amgen for sponsoring this awesome conversation. Now we'd like to invite you, our audience, to put those questions in the chat. We have several great questions, and I'm going to read those questions, if it's okay, Keisha, and use our 10 minutes that we have to get these questions going.
Okay.
Okay. So the first question reads, I notice eggs are on your food list. Should we consult our doctors first before consuming a bunch of eggs, especially for those of us who might have high cholesterol?
So the answer to that, yes, eggs is on my list. And I would tell you, if you do have a problem with cholesterol, because dietary guidelines change often, is speaking to your doctor about the limit or the consumption of eggs that you should have. I think that would be a great idea and the best thing to talk to you and your doctor or perhaps a dietitian that you're working with.
Okay, so we're still on this eggs conversation here. Do egg whites count as a source of vitamin D?
You know what? I think egg whites do count as a source of vitamin D. You're not getting the yolk. Without me, actually, I'm looking it up here, but I think egg whites do count. You may not be getting as much because you're not eating the yolk there. But yes, egg whites would count.
Okay, and this is just an Angie question, just to build on the eggs. Can we do egg substitutes or should we do a whole egg, brown or white?
I would just say a whole egg, brown or white. It doesn't matter. Whatever your preference is.
Okay, thank you for us who love eggs. Next question reads, when we add seasonings to our foods, like collard greens, does the seasoning diminish or take away from the calcium that's naturally in food?
No, so the seasonings do not take away from that. What takes away more from the nutrition in the collards or kale is how long we cook them. So sometimes we cook all of the nutrients out of them. I would caution though, and this series isn't about high blood pressure or anything, but I'm going to caution on the season of the greens and the kale because you want to be mindful of that. Because if you are at risk for things like high blood pressure and you highly season those greens, kales or collards with a lot of salt, you know, that's going to impact your blood pressure. But as far as the amount of the absorption of calcium, it's just you don't want to overcook them, because when you overcook your fresh vegetables, you tend to decrease the amount of vitamins and nutrients in them. Okay.
Okay, thank you for that. And are canned and frozen veggies calcium rich?
So yeah, so if they fall in that category that we showed, so frozen broccoli, it's still calcium-rich vegetable. If you had some asparagus and they were in the can, and yes, I've seen asparagus and okra in the can, you know, you're going to get some of the benefits of the calcium there. You just want to be mindful again of the sodium content if sodium is something you need to watch for, or salt is something you need to watch for.
Thank you. And we have 4 minutes, and we're going to try our best to get to all the questions, terrific questions. If we don't, I'm going to ask Keisha if she will take those questions, and we will get back to the person who asked that question. Is that okay, Keisha?
Yeah, that's fine.
Okay, thank you. I know you talked about us getting up and from our desk, couch, so forth, and looking at TV all the time. But let's just say we are couch potatoes naturally. Does prolonged sitting, weaken our bones?
So prolonged sitting, I'm going to say it does weaken your bones because you're not up and you're not moving. So I've encouraged or spoke about exercise for strength and good bone health. So if you're sitting, theoretically, you're not moving around, you're not giving your body or your bones a chance to exercise. You're not moving. And so, yes, sitting, being a couch potato, it's not good for you. And if you have osteoporosis, if you're at risk for a fracture, I talked about those tips and tricks. If you're sitting for a long period of time, if you have bad posture and you're sitting, you're more at risk for developing or having those vertebral fractures in your spine. So that's why it's so important for you to get up and move and stretch. So if you are a couch potato and you can get up and move around, the one thing I would encourage you to do is at least stand periodically and stretch, because that's just as important.
Okay, and then just to build on that quickly, if we have balance issues, maybe holding on to the side of a chair or a wall, a steady wall will help us to get up and move those bones a bit.
If that is the best way for you to get up, but I would say if you're having trouble with standing or walking, you need to talk to your physician. So maybe you can get a consult or evaluation with a physical therapist or occupational therapist. But whatever you're using to stabilize yourself, as long as you have something to hold on to, you're not at risk for falling, you can use that device, that chair, the side of that chair railing to stand up. But you don't need to sit for excessive periods of time.
Okay. And then the next question asks, can you have a fracture and not know it?
Yeah, so you can have a fracture and not know it. So in one of the slides, the most common times that you have a fracture and you don't know it is when the fracture is a vertebral fracture. So that's the small bones that are in your spine. A lot of times people don't know that they have those fractures because they're not painful. It can go unnoticed. Now, another fracture like a hip fracture or a wrist fracture, you're going to feel that. That's going to be more pain. So you're going to probably know that something is wrong and you're going to go get that checked out. But those vertebral fractures are often silent fractures that individuals don't know that they have. And it's not detected until much later that they've actually had that type of fracture.
Okay, perfect timing. We have 2 questions. This one is near and dear to my heart because I do it and I probably shouldn't. For those of us who carry those big old pocketbooks and tote bags and do we weaken our bones? Do they contribute to the weakening of our bones?
So what I would say is that if you have low bone density, if you are at risk for osteoporosis, if you have osteoporosis, you want to limit the amount of things that you carry in those bags, because that could put you more at risk for a fracture. So carrying a big purse isn't a jerky movement, because I told you need to avoid and stay away from the jerky movements or the high impact movement. But anything that could put you at risk for a fracture, so carrying a whole bunch of weight, you want to try to reduce that and limit that. So you could pick up that big heavy purse. You can have a wrist fracture if you've got low bone mass. You know, you could be carrying that big heavy purse. It could cause you to be leaning over, and then you could, you know, have a small fracture of those vertebral bones. So decrease some of that stuff in there, and protect your bone health. But if you don't have a problem with your bone density or bone health, you're probably not going to injure yourself. You'll have more of a shoulder injury from carrying a big purse, but you're probably not going to have a fracture in a healthy individual. But if you are prone to osteoporosis or low bone density, an injury could occur. So you want to reduce some of that weight of those things that you carry in your purse.
Okay, so I will change my handbag. Okay, perfect last question. Can osteoporosis be reversed?
So in our slides, what we talked about is that once you have osteoporosis, you have it. So taking medication, using supplements like calcium and vitamin D, it's going to prevent the fractures from getting worse. It's going to prevent further fractures from occurring. And so you're going to work then on prevention. So you're not going to be able to just stop and say, hey, I'm taking medicine now and I no longer have osteoporosis. You have osteoporosis, you're at risk for bone fractures. And so you're taking medicine and you're treating it. Is what you're doing. And then if you are that person that falls in the category of osteopenia, low bone density, you know, it may not turn into osteoporosis, but you're going to have to be proactive and do things to prevent osteoporosis from occurring.
Okay. Perfect way to end today's webinar. Thank you, Keisha, for a very thoughtful and engaging presentation. To our audience, thank you for joining us again for part 2 of this conversation about osteoporosis. And thank you to Amgen for your sponsorship of such a wonderful conversation about osteoporosis. We look forward to seeing you on April 13th. We hope you can join us and we give you back your day. Thank you.
Thank you.